Hello, everybody. My name is Joselyn Wilkinson, and welcome to the Solution Breakout Session. Joanna Carr from the Arizona Housing Coalition is our main speaker today, and I'm going to give her a second to introduce herself and her role at the Arizona Housing Coalition.
Thanks, Jocelyn. Good morning, everyone. My name is Joanna Carr. I'm the Research and Policy Director with the Arizona Housing Coalition. Thank you for attending today, and thank you to the organisers for allowing me to present. I've worked in the veteran space since relocating to the US 5 years ago. And my background comes from SSVF, Supportive Services for Veteran Families, which I'm sure many of you are familiar with. I now work with veteran communities statewide around the mission to end homelessness. That's just a part of the job that I do. The Arizona Housing Coalition, we are a member organization statewide, and we operate under 3 pillars, including coordination, which is where most of my role lies in the veteran work. So this involves the coordination of efforts statewide, and also involves a great deal of advocacy around veteran issues and initiatives to lawmakers and policymakers. So as Jocelyn said, I'll be doing the bulk of the presentation today, and Jocelyn will be joining later on in my slides. But the purpose of the presentation today is to provide an overview of some of the issues pertaining to inflow into the housing system for veterans, and also touching on the issue of veterans needing a higher level of care. These are 2 issues that have been given much attention over the last couple of years in various veteran working groups across the state. I will be focusing on work that's been going on in Maricopa County and the Arizona balance of state, and I hope to give a good overview of the work that we've been doing over the past year or so, the barriers that have been presented, and our solutions, and then also give time for questions and maybe some brainstorming towards the end. So next slide, please. So first of all, just to, I guess, set the scene, how does veteran homelessness look in Arizona? So we measure this in our state by looking at our veteran by name list. So a by name list, or a BNL, is a list of every veteran experiencing homelessness at any given time. And this data is pulled from a couple of places. First and primarily the HMIS system, which is the Homeless Management Information System, a database used across the state to track information on individuals accessing homeless services. In Maricopa County, the VA also pulled their own by name list data from their internal database. And the numbers here on the slides are the HMIS BNL numbers for February 2020, which are our latest numbers. We did just get March's numbers in, but it was a little too late to present on. But most of veteran homelessness is experienced in Maricopa County, which is our most populous county, so that makes sense. The balance of state is the 13 counties outside of Pima County and Maricopa County. It's important to use some caution when looking at these numbers, and that applies to any data. We know that there's issues with the by name list across the state, and that there's likely some underreporting, and this could be for a whole variety of reasons, including veterans not accessing homeless services and therefore not being captured. And this we see more so in our wilderness areas, in the Arizona balance of state, where people may be living out in outlying areas who might not be counted by homeless services because people are not engaging. Additionally, there's a number of services who don't have HMIS access and are not inputting data. And this doesn't necessarily mean that a veteran, doesn't get served by another service in their journey through the system, but likely there are some gaps where veterans are falling through. And then there's also issues around capacity and funding for HMIS data entry. And that we find particularly in under-resourced areas of the state, where the priority is serving the veteran and not necessarily, finding the time to input the data. Another way to understand how veteran homelessness looks is to look at annual point in time count data. So the point in time count is a national count that's traditionally done in January on a given night, and that's done nationally all across the country. There's a count of within shelters and out on the streets or outside to see, who is experiencing homelessness. In 2020, there were 921 sheltered and unsheltered veterans experiencing homelessness in the state. We did a little work to compare this to HMIS data counts for the same month, or the by name list, sorry, and found some discrepancies. So we know that the point in time count fails to capture everything, such as veterans that don't want to be counted. And there's definitely, we see a race disparity around this. For example, we see often in Hispanic and Latino communities a fear of reporting around point in time count, census, etc. And then the point in time also fails to capture those who are hidden homeless, perhaps staying in cars or uninhabitable buildings. And then again, going back to the wilderness areas, it can be quite an effort to capture everybody. But despite this, that's just working with data. Data's never perfect. But we work with the HMIS data, point in time count data, by name list data. And what we do have gives us a really good indication of what's going on with veteran homelessness around the state. And data tools have been really incredibly useful in helping us to drive decisions based on what we see, by identifying patterns that are occurring among veterans in the system. And that's what I want to be sharing today, and some of the data dives that we've done and the solutions that have been driven from that. So, before I go on, just to say, by continuing to understand the issues and the gaps that I've spoken about, we are constantly working to try to improve the data. For example, there's a huge project right now in the Arizona Balance of State to identify agencies that may not be entering data into HMIS, and then working to understand what those gaps are and how it can be filled, whether it's resources for capacity building or HMIS licenses, etc. Next slide, please. So before I dig into more kind of focused issues of this presentation, I want to give some time to equity considerations. This is because it's really important to address equity in all aspects of housing and homelessness related discussions. There are underlying disparities connected to a variety of protected characteristics that impact how individuals and households experiencing homelessness and housing instability. So we're working to understand and address these issues across various working groups related to veteran homelessness around the state. But there's a long way to go, as there is with any equity work. We always say we're really right at the beginning, and the beginning is, building awareness and understanding is that critical first step towards finding the solutions. Solutions, that we need macro level solutions, but there's also smaller steps that can be taken, and trying to help communities to figure that out is some of the work that we've been doing. Race and ethnicity is a significant consideration when looking at disparity in homelessness and housing outcomes. This here is national data that's on the screen, but we generally find that locally patterns in our national data is reflected. However, it's really important for communities to understand what their individual community looks like, really to kind of know how equity presents locally. And this is especially true within Arizona, because Arizona is just so diverse. For example, in Northern Arizona, we have a large population of Native American households compared to Southern Arizona, which has a large Latino or Hispanic population, again, compared to Central Arizona, which is more mixed in terms of race and ethnicity. So doing that data diving across our various continuum of care, how that's broken down, the three, Maricopa County, Pima County, and the balance of state. And then with the balance of state, really by county, understanding how the population looks is really important. But nationally, the most striking disparity in veteran homelessness is among Black and African American veterans, who are 33.1% more likely to experience homelessness than veterans of other races or ethnicities, which is huge. Native American veterans are also overrepresented, while white veterans are generally underrepresented in homelessness data. And there's many reasons that relate back to this issue, kind of relaying back to structural policies and systems that have created patterns of discrimination and perpetuated inequities over time. And that's kind of where I talk about the macro level solutions, which can feel incredibly overwhelming. But there are things that can be done at a targeted level to try to address inequities locally. And this is, it's a whole other presentation and discussion. There's a lot of work that can be done, but there are efforts going on to identify, I guess, the low-hanging fruit. What can we do to make some headway in addressing the disparity? And one such example is looking at inequities that may present in our assessment process. Is our assessment process culturally appropriate? Is it serving veterans of various ethnicities and races equally? And that's a conversation that's taking place right now across state working groups. And then it's really important to note that inequity doesn't stop at race and ethnicity. You'll also see on the screen here, age is a factor. Younger veterans are more likely to experience homelessness. And then there's also a significant disparity seen among the LGBTQ plus veterans in homelessness data. And that's a population that really experiences very unique barriers, such as those related to shelter access and gender. Next slide, please. So I wish to speak to some very specific barriers veterans are experiencing while trying to access housing. So this is a switching of the gears in the presentation. We are in the midst of an extraordinary housing crisis. We were talking about this with urgency pre-pandemic, and that urgency has really increased dramatically throughout the pandemic. So pre-pandemic, when we're talking about affordable housing and homelessness, the focus was generally on low income or zero income households. But now the focus is turning not only to that population, but also households that have a higher income level, such as our workforce, middle income earners. This housing crisis really is impacting more and more people. As I'm sure you all are very well aware, rents have risen hugely across the state, up by almost 30% in some areas. Occupancy rates are very low, meaning that we're struggling to find units. And this means we have a really hot competitive housing market and a significant supply and demand issue. So landlords are filling their units very, very fast. And this is resulting in real difficulty finding landlords who will accept vouchers and subsidies and work with our housing programs. We're seeing more instances of non-renewal of leases. And this, for example, this issue is occurring among our HUD-VASH voucher holders, which is meaning that this long-term housing program intended to create a long-term secure housing solution is no longer working as it was, because we're just struggling to find the landlords that are willing to work with this, because landlords have a lot of other choices to who they let into their units. The competitive housing market is meaning that background checks are more of a barrier than before, with things like criminal history and past evictions posing more of an issue in a veteran passing a housing application. The standards by which we operate our housing programs, such as income levels and fair market rents, are really not keeping up with inflation. And this is resulting in instances For example, of veterans not qualifying for housing programs due to income, but facing that reality that their income is no longer sufficient to find affordable housing. So we've been talking about how can we bring services to veterans that do not qualify for rapid rehousing, for example, because on paper their income is too high, but the reality is that with the inflation of housing and gas and food and everything, these households are struggling. Additionally, we've been hearing anecdotal instances of increase in support needs for veterans through the pandemic. So that includes around mental health and substance use support, as an example. And then some issues on here that are not necessarily related to the pandemic in the housing market, but which have been an ongoing barrier and continue to be so, are things like distrust in the system, which may prevent a veteran from taking that step to access services, a refusal to engage in services, and then trouble locating documentation, which is an ongoing issue. Any person who is going through a housing crisis, the reality of keeping things in one place, keeping their IDs, documentation together is really difficult. That's always ongoing. And then barriers to transportation is always a big issue that we talk about around veterans. Next slide, please. Thank you. So just to add a little more on the housing crisis front, this is some data from the National Low Income Housing Coalition's Out of Reach report. And what that report does is calculates what we term a housing wage, meaning the hourly wage that's needed not to be housing cost burden. And that means where you're not paying more than 30% of income on rent. So in Arizona, the housing wage is $22.30 per hour, which we know is way above our minimum wage. And you'll see here on the left that there's huge diversity in the state. And this kind of goes back to what I was saying, knowing your community locally, knowing the housing landscape. You'll see that Coconino County is our least affordable county, and then Greenlee County is our most affordable, and there's a huge difference there. But essentially, there's no area of the state where a minimum wage would suffice the affordability of a modest 2-bedroom home. So the affordable housing crisis is felt all across our state. Next slide, please. So what are we doing to address this, and specifically what is going on to address veteran homelessness? So I just want to kind of outline the various efforts statewide and how the work groups look. We have a number of collaborative efforts, and these are coordinated efforts across organization to address this issue. And that's outside of the efforts, that each housing program and organization are already doing. So it's kind of coming out of the programmatic and more coming to the table to share resources. And this coordinated approach is really important for a number of reasons, but including avoiding duplication of efforts, avoiding working in silos, and it also allows the pooling of resources and expertise and knowledge to really tackle the mission of addressing veteran homelessness together. The ultimate mission for all of us is to end veteran homelessness, and we know that can sound and feel incredibly overwhelming and often unrealistic. And so, perhaps the baby steps towards that we're always working on is, how can we reduce veteran homelessness? What are our reduction goals, and how can we start to move the needle and move towards ending veteran homelessness? In terms of the structure of these efforts, our state is broken down into 3 COCs, which means continuum of care, which basically, I guess, it's like the managing body around the coordination of efforts pertaining to homelessness, and not just veteran homelessness, but all homelessness. So most COCs will have work groups broken down into subpopulation, including veterans, but also youth, family, etc. So each COC is responsible for, let's say, the coordination and the management of efforts. And we have Maricopa County and Pima County, which are straightforward. They cover those two areas. And then we have the balance of state, which is the 13 counties outside of Maricopa County and Pima. So that one, the balance of state is, like I say, very diverse. It looks very different to Maricopa and Pima. And we're talking about a huge area, different housing landscapes, different population landscapes, but still communities come together to really work together and share ideas there. So in Maricopa County, we have a veterans work group under the COC that currently meets quarterly, and that's led by MAG, the Maricopa Association of Government, who lead the COC there. We also had, and still have to an extent, the Built for Zero working group. So the Built for Zero initiative, some of you may have heard about this. It is an initiative that is led by Community Solutions, which is a national, actually an international, they cover a few countries, nonprofit that leads in solutions to end homelessness. So their goal is ending homelessness, and they really drive efforts around data, building by name lists, case conferencing, and kind of equip communities to get those tools together and work towards goals of significant reductions eventually. So we were working in Maricopa County with Built for Zero for quite a number of years, and recently they made a switch over to focus on the chronic homeless population. But because we have such a high number of chronic homeless veterans in Maricopa County, I believe it's normally around, I want to say 170, around there, changes obviously every month. There's still a veteran aspect involved in the Built for Zero work. But also we have what we term an Inflow working group, and that came from some of the Built for Zero work that we were doing initially. And that's just become like a small working group that's really making some headway and driving some solutions, and I will be going over some of that work in a moment. And then there's also a work group for the veterans needing a higher level of care, which is led by the CRRC, and bring stakeholders to the table, I think every 2 months now, to talk about that specific population. In the balance of state, the balance of state COC is led by the Department of Housing, and we have bi-monthly convenings, so very similar to the MAG, Maricopa Association of Government meeting, just coming together, stakeholders from around the whole balance of state coming together to discuss solutions. We are always trying to grow that working group. We don't have representation from every county, so if anyone on this call is interested in joining and joining the discussions on solutions, please reach out. I'd be happy to speak to you about that. And then we've recently formed a veterans race equity subgroup. That's a very new subgroup, but recognizing that there are inequities in our veteran data around the Arizona balance of state, we wanted to create a working group to start to address that. And then the Pima County COC, they are also a Built for Zero community, and so their meetings are generally driven by Built for Zero. So again, working towards those reduction goals. And then finally, very new to this year, we also have the state breakthrough for housing the homeless, and this came from a Department of Housing initiative. The Department of Housing tasked the Arizona Department of Veteran Services to focus on veteran homelessness, and so a small work group has been formed, led by Director Wright of the Department of Veteran Services, to come together to find a solution that the state can get behind. So we've been focusing on veterans needing a higher level of care in that working group, which Joselyn is going to speak to later on in these slides. Next slide, please. So I wanted to talk about some work that we've been doing with the Inflow working group, this is specifically in Maricopa County to address inflow. So inflow, some of you might be asking what that is. I sat in meetings when I first joined the veteran work a few years ago, hearing inflow and not really understanding it. Inflow refers to any movement into the homeless response system, as opposed to outflow, which essentially means housing veterans or veterans self-resolving and moving off the by name list. So looking at inflow, Solari's HMIS team helped us with a data review so we can look at some patterns. So, you know, who's coming into the system, what does the demographic look like, what are the, you know, where are some problem areas? So we looked at HMIS data for veterans over a 2-year period, being 2019 and 2020, and we found that there were almost 5,000 veterans that touched the homeless response system in that time. And 470 of those had returned from being housed through programs back into homelessness. We found that 41% of all veterans in the system were over the age of 60, which is a really important point to pull out. You know, it's a significant amount of senior veterans. And this really correlates with the increase in senior homelessness across all populations. You know, you may have heard this term silver tsunami, which refers to seniors on a fixed income that are really struggling in this rental market. You know, the fixed income is no longer serving individuals. You can't find a unit that's affordable with a fixed income. Significantly, we found that 79% of all veterans touching our system had been diagnosed with both a mental health disorder and substance use disorder. And this is something that we really caught our attention, because, you know, we always talk about how veterans experiencing, you know, veterans are one of our most vulnerable populations when we're talking about homelessness, and this data really drove that home for us. Next slide, please. So we want to talk about some key findings of this that we decided to focus on in the return to homelessness data. We learned that 99% of veterans that had returned to the system, so that was I think it's 470 total, 99% of those had a dual diagnosis of mental health and substance use disorder. So that indicated to us, you know, that there were perhaps gaps in access or delivery of mental health and substance use services that we wanted to try to explore. We also found that the main reason for homelessness generally were economic issues such as job loss, and then family disputes or overcrowding. And this piece, I think, perhaps is indicative of the high rate of rent right now. So many people are forced to live together out of necessity, and that can obviously lead to some familiar disputes. And you know, we were finding that there was a high rate of that, which was forcing veterans back into the system. Next slide, please. So our next step then from looking at this data is to really focus down, you know, what did we want to focus on? What did we want to find some solutions to? So we just decided to spend our time really through 2021 and into 2022 focusing on these returns back into homelessness. We also, as a community, inside and outside of the Inflow working group, have been focused on veterans needing a higher level of care. And this has been a historic gap, you know, for our most vulnerable veterans, our communities across the entire state. And from what I've heard, you know, we can say nationally, this is an issue, you know, the communities have really struggled to find solutions with. So we're going to talk in more depth about that later. Next slide, please. So our next step for the Inflow working group in Maricopa County, from looking at that initial data set, was to do a deeper dive of the veterans that had returned back to homelessness. So we really wanted to dig deeper and see, well, what exactly is going on? What's the qualitative stuff there that we can draw from? So we took a random sample of 10 veterans that had returned to homelessness in this 2-year period and took a look at their HMIS records to really understand what is going on. And I have to give credit here to US Vets who did this analysis for us and who really did that hard work. But what was identified was that there was a really high number of returns back from SSVF rapid rehousing. So a number of things that we discussed around that included issues pertaining to equity. You know, historically, and this again is across all populations, there's a disproportion of Black, Indigenous, and people of color veterans or household being placed into SSVF. And that can relate often back to assessment processes and tools, you know, perhaps not equitable assessment processes leading to, I guess, a housing intervention that doesn't necessarily serve the veteran. So we did talk in this conversation about progressive engagement piece and how, you know, when we've done progressive engagement, which for our community looked like moving veterans from SSVF into HUD-VASH, when those recognized more needs that couldn't be met through SSVF, that had resolved some of these issues, and we wanted to continue to highlight progressive engagement as a good practice and keep encouraging that. We also discussed how anecdotally veterans are returning to services when it's really too late. So instead of reaching out, for example, to a former SSVF case manager for help, they were waiting until eviction to get help again. You know, in the case of something like a job loss. So, you know, a veteran may have been at risk of eviction or lost their housing, and instead of reaching out before then, maybe had walked into the CRRC again once they've become evicted. We found job loss was a common issue to a return to homelessness. And then we also identified substance use and mental health disorder, which, you know, just keeps coming up, along with returns to jail as a reason that came up for returns back into the system. So that's something that we want to be focusing on too. Next slide, please. So what did we do next? There's a checklist here on the slide that kind of shows what our action steps are and what we've done and what's in progress. So we use this data to inform discussions that led to actionable solutions. So this included exploring existing programs and supporting their use. For example, in Maricopa County, we have the Aftercare program, which provides longer-term case management to those exiting GPD. And then also the VA shallow subsidy. We wanted to, with the aftercare program, it's underutilized significantly, and this is a continual thing. And so we wanted to continue to engage the community and educate to say, hey, the aftercare program is available in these situations. Here are the case manager details. Please continue to use this. And it's just got to be an ongoing reminder. The VA shallow subsidy that was introduced to SSVF programs nationally in last year, and it extended the subsidy for housing costs past SSVF program exit up to 2 years. So extending the subsidy without the case management or just light case management. And this was really greatly received when we heard about it, because it's a really welcome solution to what we're seeing with the housing market being the increasing rents. And it's allowing more financial assistance for veterans who don't need full case management, but who still need their rent to be paid and who otherwise would be at risk of losing their housing again. So that came at a really great time when we were starting to explore what can we do to tackle these returns to homelessness. So the Inflow working group, we were able to help with the drafting of the proposal for rollout. as a community, including requesting that SSVF providers outreach to veterans who had recently exited SSVF to check up and see if they're at risk of eviction, and therefore see if they may qualify for homeless prevention and therefore the shallow subsidy. The Inflow working group has also completed a number of support packets to try to address these issues, including a packet for landlords who have housed veterans through programs to encourage healthier communication in the event of non-payment of rent, and to help them to guide a veteran through resources. And this was born out of an idea from COVID-19 pandemic, when we're at the beginning of that, and there was no moratorium in place, there was no emergency rental assistance, and so we were really relying on landlords to just engage and build relationships with our renters, and that whole we're all in this together thing. And so there was a few national packets that encourage healthy communication, so we were able to take some of that language for this, because essentially healthy communication between landlords and renters is it's important ongoing. And then we also created a packet for veterans on program exit to provide useful resources. And we're also working on a packet for veteran service providers focused on services outside of housing, such as employment, addiction, mental health, etc. And that will include VA services and also non-VA services such as access. And the reason we want to focus on that is because there's such a wealth of resources out there. We know that housing providers are so busy dealing with their clients that it's often hard to spend the time finding the resources, and so we want all these resources kind of in one place, easy to access. So that's something that we're working on right now. And then to that point around things like access, we've also focused on building the relationship between housing and healthcare, inside and outside the VA, which I'll go into in a bit more depth in a moment. But the image on the screen here, this is just a draft of the veteran provider support packet that we're still working to improve. And credit needs to be given to Aaron Lawton. He's an ASU intern that has been working with our Inflow group for the last few months, and he's helped to put this together. The other resource that we have that's in the works is an information card in the form of a business card. It was discussed, the sad reality that when veterans were passing away in housing programs, it was often noted that veterans would always be keeping their wallets close, and that's where staff were finding contacts of family members, etc. So knowing that veterans and people in general just struggle to manage and keep resources such as paper guides, we hope that a resource in the form of like a business card that can be put into a wallet with some key contacts, including Be Connected and the CRRC, will help veterans to reach out before a housing crisis in the event of that risk of a return. So that's something that's in the works. And this is all work that's been done in Maricopa County, but it is possible that these guides can be broadened. And so we do want eventually to create other versions that can be used all around the state. And then I mentioned the jail returns earlier, and that's something that's pending. We really want to eventually dig a little deeper into jail returns and see where there might be some other gaps that could be addressed, and it could just be simply educating service providers on the re-entry programs that exist. Next slide, please. So I just wanted to spend a little more time just explaining the coordination that we've been doing between housing services and health services. We took some steps to address this on the basis of finding the need related to mental health and substance use services that we saw in the data. We know that not all veterans qualify for VA healthcare, and that there might be gaps in healthcare provision for various reasons that could be filled through other healthcare services, such as access. So veterans can be dual enrolled in access and the VA. We also identified that there is a knowledge gap among housing staff related to available services under programs like Access. And so we took some steps to bring healthcare providers to the table. We had a meeting back in January, just a discussion as to what services can be offered to veterans. And we're working on contacts and education to continue to improve the knowledge between both sectors. Because what we also learned in this process is that the knowledge gap rings true the other way around. That often healthcare providers don't understand the scope of housing services. And it's fair, that the two sectors that intersect. But I once heard that, both sides speak different languages. And I think we can all attest to that, with our overuse of abbreviations and terminology in our housing related language, that also is the same for healthcare. And so when we have this housing knowledge, we don't necessarily have the health knowledge. And so just generally, there's a greater need for cross-sector collaboration. And we're hopeful as we keep working towards that next step of bringing the two sectors together. So action steps that arose from that conversation included ongoing education for both sectors, which we're still working on. I'm hoping to have something not a one-off, because housing staff, there's so much turnaround, but something that can be provided time and time again for both housing and healthcare, and then streamlining the ALTEX process, which Joselyn is going to speak to in a little more detail when she talks about veterans needing a higher level of care. But really, that is just, what can we do to make the ALTEX process easier? And that's the Arizona long-term care system, talking about speaking in abbreviations. So that's, the process for veterans that are really needing that higher level of support. How can we streamline so that veterans experiencing homelessness can have an easier ride, I guess, through the application process. And then the other thing that we're looking towards is data sharing. How useful would it be if we can share data between healthcare services and the VA? But for now, that's a huge conversation. That's definitely not something that we're anywhere near towards, but it's just in the works. And then for now, we've built the contacts are exchanged, and the conversations are ongoing. We just want to keep building that bridge towards greater coordination. Next slide, please. So I just want to introduce this just before I pass it over to Joselyn. But the subpopulation that we've really been struggling with historically to bring necessary resources to, and that's veterans needing a higher level of care. And the gap has been really finding short-term housing solutions from the point that a veteran needing a higher level of care is identified as homeless or at risk, to their long-term solution panning out. So veterans needing a higher level of care are those who are unable to take care of basic needs due to cognitive dysfunction, serious physical disability, and shelter sites are just not usually equipped to provide space for this population because their facilities and staff are just simply not set up for this level of care. So this is a huge gap and something that we're making real headway in. So I'm going to turn it over to Joselyn now, who can speak more towards what we're doing around that. Thank you.
Thank you, Joanna. Does anybody have any questions for Joanna before I kind of jump into what the pilot program's looking like for this? You can just enter them in the chat. And Joanna's very thorough and a wealth of knowledge. So now's a good time to ask any system level questions on what's happening in the homeless veteran space.
I do see a question from Justine. How is each county identified as a breakout of the total? Currently in Cochise County. I can give you those figures, Justine. I'd have to look them up. I can put them in the chat in a moment. I'll look them up, but we do get figures from each county. HMIS provides that. for the balance of state. So it is broken down. And generally we find it's Coconino, Mojave, and Yavapai who consistently have the most veterans experiencing homelessness in the balance of state. And then Cochise, I believe, is lower down. And then there's areas like Graham and Greenlee that are consistently showing as 0, but we know that there's issues around HMIS access there, which we're working on. So I hope that helps. But yeah, well, I'll find that figure for Cochise and put it in the chat.
Okay. I saw that question too. Any other questions? Okay, well, you still have time to put stuff in the chat, and I'm just going to briefly talk about the pilot program that Arizona Department of Veteran Services will be funding, and just kind of give a overview of what it looks like, the gap we're going to be addressing, and the collaborators that are involved in the pilot program. Again, my name is Joselyn Wilkinson. I'm the Homeless Veteran Program Administrator for Arizona Department of Veteran Services. And Joanna and I work alongside each other in all aspects of statewide veteran homelessness. So it's awesome to have her as a partner, and just thank you, Joanna, for your knowledge and breaking everything down on what's happening statewide. Okay, so the pilot program, it's going to be meeting the needs of homeless veterans requiring a higher level of care, who otherwise would not be able to access the shelter due to their complex needs. So they have severely mentally ill, they have coupled with medical illnesses, just a compilation of barriers that makes it impossible for them to live alone. So they need assisted living facilities, skilled nursing facilities, work group homes, something where the housing is attached to some supportive services medically. There is no single immediate solution right now for these veterans. So they are so vulnerable due to their sickness and how sick they are. And the VA has really struggled to secure reliable options for them. So a lot of times, and we want to thank the VA for even providing this option for them, is they utilize their VA hospital emergency rooms as a temporary solution until something can be figured out with the veteran. Veterans in this situation usually resolve over time, but it's usually between 3 to 6 months, depending on the application process paperwork. So the veteran would need to fill out an all-text application, an aid and attendance application. They need to be assigned a veteran benefits counselor to secure their veteran benefits. So all this application process takes time. So in between that time, the veteran is usually in an emergency room at the VA while the paperwork is being processed. So this pilot program is going to be filling that gap in. So the funding process is $150,000, and we're going to be working with 15 veterans to bridge that gap. So basically what we're going to do is put these veterans and place them in the higher level of care provider services that they need, whatever that is, a skilled nursing facility or an assisted facility, while they're going through the application process. So we will bridge them for 3 months and possibly 4 if needed. And then once their services kick in, then they can take over from there. This is a statewide pilot program. All the regional VA healthcare systems are a part of this and working with us. Be Connected is also a partner and collaborator in this. The Arizona Housing Coalition is also collaborating in this. And we have the experts from Altex and Access, a part of the work groups that are around this to ensure that everyone that is involved in the process understands the eligibility criteria for the applications to kind of ensure a smooth process. Penny, I know this, I didn't ask you, but I just wanted to see if you wanted to speak to some of the conditions the veterans come in at the CRRC that would qualify for this, and maybe some of the barriers that you guys see on the front lines. Let me see, take her off mute.
Jocelyn, who is it you're trying to unmute?
Penny Miller.
All right, 1 second.
Hi there.
Hi, Penny.
Hi. Yes, so Jocelyn, were you just asking like in terms of in general, how a higher level of care needs veteran might present to the CRC?
Yes, exactly. Yes.
Yeah, so yep, we have veterans that will present to the CRC for services, or the community will bring them to us for services. And these are veterans typically that are, you know, they might be in a wheelchair, or just think frail, more can't meet their daily needs in terms of, you know, mobility wise, maybe not being able to transfer themselves out of their chair. They're not able to, you know, go to the store and feed themselves. They can't feed themselves. They can't cook their own meals. They may not be able to take care of their bathing and toileting needs. They may even be to the point where their memories are impaired, where they may not be safe on their own, you know, to maybe be left on their own, you know, especially with maybe an oven or something, catching something on fire because they'll forget the stove is on, or get lost because they're wandering. Hopefully that kind of presents. These are veterans that, for the transitional housing programs that we work with currently, like US Vets, Humana, Ozanam, they all provide a great deal of a variety of services and care and support, but they are not at that level of care. So they don't have some sort of skilled nursing or nursing assistance, or somebody that could be there more for med management on site, or to help them do those daily activity needs. So those are veterans that we would try to, if we had no safe place at that moment, that we are working with the VA for a medical review to see if they need to be admitted, at least until we can get another option in the community.
Thank you, Penny.
Yeah.
Matt, you can go to the next slide. So this is basically I kind of really summarized this part earlier in the first slide, that is 3 months of assistance, including flexible funding. So they'll get that assistance along with $500 to secure any other needs that they're having. And then we talked about the partnership that's happening with the pilot program. And then I'm just happy to answer any questions if you guys have any questions about the pilot program.
I have something to add too.
Oh yeah, go ahead.
While questions come in. So I think one thing we want to really focus on in this pilot program is the long-term sustainability. So we've had in the past, you know, flex funds maybe coming through to our community one time. Like for example, we had $100,000 from Quicken Loans as part of Built for Zero in Maricopa County that we were able to serve. I think it was 7 veterans in this situation, and providing those upfront costs for assisted living, which was really helpful. While the VA staff worked on the longer term solution, and then we spent up all that money, and then it's like, okay, we're back to square one. And so what we don't want from this pilot is another kind of, okay, great, we can serve 15 veterans, and then we get to the end and it's like, okay, now let's start again. And so we're building this out and actually spending a lot more time on this than we initially had anticipated, because we want to really set this pilot up so that we have a really great example of success. Hopefully that's the goal, to go to either, our legislators, the governor, based on like funding that might be available still under the American Rescue Plan Act, or, our wildest dream would be the VA nationally, to say like, hey, look what we did in Arizona. This is a need. We need this program, this to be a program that's built into our system ongoing. And so that's kind of the dream, I guess, and what we're working towards. And so I just think that's really exciting, because this has just been something that we've spoken about as a gap for so long, that we just really want something that we can rely on to meet our most vulnerable veterans. So that's all I had to add.
Good stuff. Thank you, Joanna. And you really hit it. I feel like Arizona could be a leader in bridging this gap permanently and knocking it off as one of the barriers nationally that we're seeing. So there's a question: is that $500 during the 3-month period of assistance a one-time financial support, or is it $500 per month? It'll be a one-time financial support during the 3-month process. That's a really good question.
There was
Any
another
other-
question. What is the name of the pilot program? We don't have a name right now. We're still trying to work out the details, but once we have that, we'll spread the news.
Yeah, and if you have any ideas on what you'd like to name it, you can shoot us an email. Here's another question. Is there a different assessment tool the VA will utilize to identify a veteran is in need of a higher level of care? Often that's the challenge, is that the veteran is not identified as eligible. The questions are coming in now. Hold on one second. I bumped it up. Identified as eligible for assisted living. They don't meet ALTEC's criteria. And so we're struggling to identify an appropriate placement outside of transitional housing.
So my understanding is that there won't be a different assessment tool, that the VA will be using their existing assessment tools to identify a veteran needing a higher level of care for this pilot program. But Valerie, maybe we can connect with you outside of this to kind of learn more about what you mentioned, because like I say, we want this to work.
Yeah. Joanna, there's another question. What is the percentage of women veterans versus men veterans who are unhoused?
Specifically in Arizona, I don't know that off the top of my head, but I can find that information and share it perhaps after the event.
Okay. Awesome, Valerie. Do you have Joanna's email? Joanna, do you want to put your email in the chat?
Yeah.
Any other questions? Anybody want to talk about what they're seeing on their front lines as barriers to getting veterans housed, or trends you're seeing on the front line?
Cooper.
Ralph says, I'm sorry if this has been noted already, but is there an understanding of the number of housing or facilities that are designated in Arizona or in the various counties for this special need of care?
We don't have, I guess we don't have I guess, an inventory of like assisted living facilities. I think that's perhaps what you're talking about. But what we intend to do with this pilot program is to build a relationship with assisted living facilities, group homes, etc. So to make this program workable. And honestly, I think most of that is already done. I know VA staff already work really hard with this population to try to find solutions. And so there's already a knowledge among the VA social workers of what facilities already exist. We just don't have, I guess, that inventory.
In Cochise County, we are seeing more veterans relocating from out of state who are in need of housing and employment. Yeah, I think that's a trend statewide.
Yeah, that's a trend, not only among veterans too.
Mhm.
It's something that's just adding to the affordable housing crisis and the supply and demand issue generally, is that especially there's relocations from the even more expensive areas, you know, like areas like the Bay Area, New York, all of these like traditionally very expensive areas that people are just getting pushed out of and are coming into Arizona. So yeah, that's something that is being seen all across the state.
There's another question from Stacy. It says, I work at ASU, and at the beginning of each semester, we often have a few veteran students who are not prepared to get into housing or assume their BAH is automatic at the beginning of each semester, and we often scramble to find them housing temporarily. Is there temporary housing for young veterans?
There isn't anything specifically in terms of, you know, just generally temporary housing for young veterans. If the veterans are experiencing homelessness, then they can be assessed through coordinated entry, which, you know, it's ASU, assuming you're in Maricopa County, and so that would be through the CRRC, but it would be the general homeless response system that the veterans would be assessed under, which is, you know, an assessment for GPD transitional housing. Otherwise, it would be the case of the students going through the usual tunnels of trying to find housing.
Joan Dermott says this is a very creative pilot program. Looking forward to hearing what is learned, and that hopefully it will transition to an established program in Arizona. That's our goal. We hope that too. I also forgot to note, Joanna, we are collecting extensive data on the pilot program, so we'll be able to report out findings as we're housing and placing these veterans, and looking how long it takes from application to completion. So we'll be able to get some good data on you know, what really is the gap, and if we were able to fill it. Leandria says, I think you addressed many of the concerns. The lack of trust for government systems and the growing level of support within the homeless communities should be considered. The homeless communities are becoming more resilient, and individuals within the group are more supportive of one another. In contrast with homeless, in contrast with homeless communities with homelessness, which seem to be an isolated situation in the past. That's true.
I do agree on the resiliency,
Yeah.
and it's, you know, it's sad that this is a growing need, which, you know, is growing, that need for community and looking after each other. So thank you for that. I saw there was a chat, a question just before Leanne from Jeff.
Okay.
Does the use of the emergency room reduce services for veterans needing emergency medical care? if I'm understanding what was stated by these veterans in the pilot. So that's a good question. And Penny may want to jump in on this, but you know, the VA have done a really good job at like finding the creative solutions to this problem, and you know, making that partnership with the emergency room. But you know, absolutely, it's the case that the emergency room isn't a housing solution, and I think it just speaks to the fact that this is just a huge gap, and it's somewhere for veterans in this situation to go. And we need that, because otherwise oftentimes it's the alternative is the street. So it's taking away, I don't know the extent to which it takes away veterans needing emergency medical care, but it's reducing the capacity, right?
For sure.
Medical.
Hi there, again, it's Penny.
Okay, go ahead, Penny.
Oh, but yeah, I think Joanna summed it up. I mean, mostly it's just been, and I know we had this conversation with the Southern VA had participated in the group when we were discussing the pilot, but really it comes down to the creativity and the partnerships with reaching out to the community and the caseworkers at the CRCs, social workers, and the peer supports, really kind of working with the network out in the community and identifying who would work with us at certain homes that could take the veterans for, you know, to work with them with the income that they had available or pending some sort of assistance. It is it's really, I can't stress the amount of creativity and partnerships with those individuals in terms of, yes, it being a gaping need, it's also a safety issue. And that is why there are certain situations that you cannot ethically, as a provider, let someone go back out the door when you know that it is not safe for them to be on the street. Hence becomes the relationship with the emergency department and the teams there to determine whether or not they need to be evaluated for medical complexities that could be an admission worthy need. So I want folks to understand that as well. It's not just, you know, any veteran. These are safety issues that you have to really evaluate and assess. And then, as I think it was in a slide earlier, that the transitional housing settings, you know, are sometimes beyond their need, you know, and I know they have stretched their wills as well, and going out of their way to provide services because of that veteran needing something until we could bridge that gap. So it is certainly not just the veterans. We recognize that that's a community-wide issue for that population as a whole.
Yeah, thank you, Penny.
Thank you, guys.
We have time for one more question. There's 2 minutes left. Joanna, there's an income discrimination question that you've been, did you see it?
Yeah, so
Okay,
the
go
question
ahead.
is from Ralph. I've heard that from a property manager that many new property owners are no longer interested in accepting HUD vouchers and rapid rehousing recipients. How can such a resistance be curbed or addressed in good conscience? That's a really great question and incredibly relevant to our housing market today. And this is something that we're just constantly coming across, and it's a condition of our housing market. You know, a property owner, you know, has so many applicants. If somebody's coming to them with a HUD VASH voucher compared to somebody who has their own income, they're going to take that person. That's the reality, unless they do have, you know, a good heart. So a couple of solutions to this, one being landlord engagement. And this is something that we keep talking about, is like, how can we, or is it possible to have like a specific landlord housing engagement for veterans? So somebody who's going out into communities to build relationships specifically with landlords around housing veterans. However, that needs to be paired with, you know, not only the goodwill, but also the incentive. You know, what's the bonus for a landlord? And there are some programs coming through. specifically again in Maricopa County, don't know of any in the Barnes Estate, unfortunately, or elsewhere, but funding specifically for landlord engagement. Honestly, what we're hearing is that landlords are often not even interested in that. You know, so if something's coming through like, hey, here's a $2,000 bonus for sign up, it doesn't still make sense to a landlord financially. So it's not necessarily working in all cases. Joselyn mentioned source of income discrimination protection, and this is a policy solution that the Arizona Housing Coalition are focusing on. And that would be to add income protection to the list of protected characteristics around housing discrimination. And so that would mean that a landlord wouldn't be able to refuse to rent on the basis of a landlord having a HUD-VASH voucher or any other housing subsidy. The problem with that is that there's nothing right now in Arizona. Ideally, it would be amazing to have this in federal law. State law would be great. There's going to be a whole lot of pushback from landlords and property owners and developers around this, because the conversation is that they would see it as being forced to accept the program. Alongside this, for this to work, there needs to be improvements to the HUD-VASH process and the support to landlords. You know, there can't be issues of landlords not getting their payment on time, or extensive paperwork and delays and no support. So there has to be a review of voucher programs at the same time as exploring any source of income discrimination protection. Tucson is looking at it right now. There's a few other municipalities who are interested in it. So the conversation is in the works. It's not an immediate solution, but it's something that we're looking at.
Thank you, Joanna. And that's our time for today. So thank you all for joining us. You guys have a great day. Enjoy your lunch.
Thanks.
Bye.